Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the fourth anatomy lecture of this block. So, Bismillah, let's start. So, in this lecture, we're going to talk about the blood supply and the surface anatomy of the heart. So, we're going to talk about the arteries that supply the heart, the veins that drain the heart, and all that. So, starting off with an outline of the blood supply of the heart. So, we have arteries and veins. So, the arteries, we have two arteries. It's actually one, اللي هي coronary artery. But we're gonna have the right coronary artery and the left coronary artery. We need to know the origin حقتهم, the courses, branches, termination, and clinical applications. Okay? But then we have the veins. The veins we have three. We have the most important one is the coronary sinus. Okay? So we have the coronary sinus, then we have the anterior cardiac veins, then we have the vena cordis minimi. Okay, for the veins we just need to know their name, location. We don't need to know as many details as the arteries. Okay, so we're going to discuss them further on in the lecture. So before we start with the arteries, we need to talk about a very important structure known as the aortic sinuses. What are the aortic sinuses? If you remember in the previous lecture, we mentioned that here we have the aortic valve and here we have the pulmonary valve, right? So we said that for the aortic valve, we have, it starts with an A, so it has two anterior cusps and one posterior cusp. أما pulmonary, it starts with a P, فقلنا it has two posterior cusps and one anterior cusp. Okay, this is just عشان نربط المعلومات ببعض. Okay, but what do we need to know here for the aortic sinuses? We need to know in these cusps that we mentioned before, these cusps have spaces. Okay, spaces which are known as sinuses. So the sinuses هذول we're going to name them after the area they're in. So this is going to be known as the right sinus or the right aortic sinus. هنا the left aortic sinus. وهنا the posterior sinus. تمام؟ What's the importance إنه نعرف these sinuses? لازم نعرفهم لأنه they're the origin of the coronary arteries. The right sinus or the right aortic sinus is going to be the origin for the right coronary artery. أما left sinus is going to be the origin for the left coronary artery. تمام؟ posterior ما عنده origin or ما عنده artery. Okay, it's not an origin for any artery. But the right and left are very important because they're the origins of the right coronary artery and the left coronary artery. So remember that. And one more thing is that the aortic sinuses are at the beginning of the ascending aorta. طيب, so we can say in general كده إن the coronary artery originates from the ascending aorta, mainly or specifically من وين؟ من الساينسز. تمام؟ so إذا قلنا coronary artery originates from the ascending aorta صح. وإذا قلنا coronary artery originates from the aortic sinus برضو صح, because they're both considered were part of each other. يعني aortic sinus is part of the ascending aorta, while coronary artery originates from the sinus which is part of the ascending aorta. تمام؟ تمام. Now let's start with the arteries. So for the right coronary artery, it's the dominant artery in most people. What does that mean? It means إنه هي اللي مسيطرة في أغلب الناس. Okay? There's always exceptions, but we're talking about the majority. Okay? So for the majority, the right coronary artery هي اللي مسيطرة في الهارت. Okay? So the origin قلنا it's the right aortic sinus. ممكن برضه نقول ascending aorta because we said they're part of each other. And course. What is the course? Course means إنه path or the route that this artery moves in. تمام? So in general كده we can say إنه course for the right coronary artery, or it runs in the coronary groove. من اسمها coronary artery, so it runs in the coronary groove. Okay? بس let's see it in more details عشان نفهمها أكثر. Okay? So قلنا من اسمها it's the right coronary artery, so it's going to be on the right side, so we're going to forget about the left side. So طالما هي في right side وفي coronary groove, coronary groove يلف لفة كاملة حوالين الهارت. It rotates or it surrounds the heart from all directions, right? From the anterior surface, the posterior surface, all the surfaces. Okay? So let's start with the anterior surface. Here we can see the right atrium, and this is the right ventricle. وهنا groove, coronary groove, right? So this is going to be the origin, or this is where it originates. We said it originates from the ascending aorta here, right? But it's deep, we can't really see it in this diagram. But it originates somewhere here, من هنا, من تحت, okay? So it comes here, it goes in the groove. تمام? Once it goes here in the groove, it's gonna be between the right atrium and the right ventricle. صح? صح. So this is the first part. Then it continues here and goes to the posterior surface. So imagine this as a 3D diagram with me. Imagine إنه كذا هنا anterior surface راح in the groove between the right atrium and the right ventricle, and then it goes to the posterior surface. يعني قلبنا الهارت من ورا. So this is the posterior surface. Then it goes to the coronary groove, it's still in the coronary groove but on the posterior side. So هنا it's, where is it exactly? It's underneath the inferior vena cava. So it's underneath the inferior vena cava. This is the superior vena cava and this is the inferior vena cava. So هي جت في coronary groove تحت inferior vena cava. Then where does it go? خلاص, it leaves the coronary groove. Where does it go? It goes to the posterior interventricular groove. Posterior interventricular groove. This is the posterior interventricular groove between الإيش, between the left ventricle with right ventricle. تمام? So this is إيش, this is the course حق right coronary artery. تمام? This is everything here we just said. بعدين let's move to the branches. Now let's see. The branches for the right coronary artery are 8 branches. Let's see them in a very simple and easy way. طيب, how are you going to remember them? We're going to remember them like a story. أول شيء قلنا this is the coronary artery, right? قلنا هنا this is the coronary artery اللي between إيش وإيش, between the right atrium and right ventricle in the coronary groove. This is what we said above, right? So منطقيا, logically, once we have this groove, this artery is going to supply everything around it. Yani look, it's giving branches everywhere around it. It's supplying everything around it. So what's going to be around it? مبدئيا, this is إيش? This is the pulmonary trunk. This is the ascending aorta and this is the superior vena cava. So the first branch it's going to give it to the إيش? To the ascending aorta والpulmonary trunk لأنهم هم أقرب two structures to it. So the first branch that's going to come out from the right coronary artery is going to be to the ascending aorta and to the pulmonary trunk. Okay? The second branch is going to be to إيش? Right conus of the infundibulum. إيش الانفundibulum? Infundibulum is the area between the right ventricle and the beginning of the pulmonary trunk. So the area اللي في النص هنا where the valve opens is known as the infundibulum. Okay? So it's going to give a branch قلنا أول شيء to the ascending aorta and to the pulmonary trunk. بعدين branch هنا للinfundibulum. Okay? كده خلصنا with 2 branches. Then it's going to give 2 branches to إيش? إحنا مو قلنا it's between the right ventricle, right atrium, and the right ventricle. يعني it's in the middle, it's the coronary groove. So it definitely needs to give a branch to the right atrium لأنه it's literally like underneath it. So it needs to give this a branch. So it's going to give a branch to the right atrium. بعدين it's going to give 2 branches to the ventricle. ليش؟ لأن الventricle أكبر من الatrium. The ventricle is larger than the atrium, so it needs more supply than the atrium. The atrium is small. It can only have one supply. So it's gonna give 2 branches to the ventricle, which are إيش? Ventricular branch to the right ventricle here, which is number 6. So this is the ventricular branch to the right ventricle, and it's gonna give another branch here on the side or on the surface. On the margin is known as the right marginal branch, which is to the right ventricle. So for the ventricle, it's going to give it 2 branches. The ventricular branch with right marginal branch. Ventricular branch with right marginal branch. For the atrium, it's going to give it only 1 branch known as the atrial branch. تمام؟ كده we're done with the branch. قلنا الاسcending aorta والpulmonary trunk اللي هي هنا. بعدين قلنا الانفundibulum. خلاص. بعدين we said arterial branch and the ventricular branch and the marginal branch. كده we have 2 more branches left, and the last one we're going to talk about it at the end. So these 2 branches are together. ليش؟ لأنه there are branches that go to the SA node and the AV node. So as we know here, the SA node is here under the or close to the superior vena cava. Okay, so this branch is going to be given to 65% of the people from the right coronary artery. يعني 65% of people in the world are gonna have the artery of the SA node from the right coronary artery. طيب والباقي من وين حنشوف in the coming slides. Okay, but all we need to know here is that in 65% of the people, the artery of SA node is gonna be from the right coronary artery, or it's gonna be a branch of the right coronary artery. What about the AV node? نفس الشيء. 80% of the people are gonna have the artery of the AV node from the right coronary artery. Okay? The last branch is the posterior intraventricular artery. Posterior intraventricular artery. It has another name. What is it known as? It's known as PDA. So, posterior interventricular artery, or PDA. What does PDA stand for? Posterior descending artery. So it's either known as posterior interventricular artery or posterior descending artery. Where is it here? It's in the posterior side, so we can't really see it here. We're gonna see it here. Okay, so this is the PDA. Sorry, no, this is the vein. It's this one. PDA, which is known as the posterior descending artery or posterior intraventricular artery. تمام؟ ليش؟ لأنه this is the left ventricle and this is the right ventricle وهي في النص. So it's the posterior between the two ventricles, or ممكن نقول posterior descending artery لأنه it's descending, it's going downwards. Okay? What's important in this artery? We need, as we can see here in the diagram, we can see this is the artery, the one in red, right? معاها there's a vein with it, right? So these two this vein and artery are paired together. They always go together. Okay, we're gonna talk about the vein in the coming slides when we talk about the veins. But for now, just remember إنه PDA اللي هي posterior descending artery or posterior interventricular artery, الvein اللي يمشي معاها is known as the middle cardiac vein. The middle cardiac vein. So remember, PDA معاها middle cardiac vein. PDA معاها middle cardiac vein. This is very important, okay? And the doctor said she might get a question about it. So she said, in the posterior interventricular groove, which of the following is present? And she's going to give us like options, okay? So the answer is going to be posterior descending artery or posterior intraventricular artery and the middle cardiac vein, okay? So the artery is going to be PDA and the vein is going to be middle cardiac vein. تمام? And where do they run? They run in the posterior interventricular groove. This is important. They run in the posterior interventricular groove. تمام? So في posterior interventricular groove عندنا PDA وعندنا middle cardiac vein. تمام? What do they supply? What does this supply? The PDA اللي هي posterior interventricular groove. What does it supply? It supplies the diaphragmatic surface of both ventricles. Then we know this surface or this area is known as the diaphragmatic surface, صح? So it supplies a diaphragmatic surface حقت الventricles, حقت both ventricles. And it supplies the intraventricular septum. بس 1/3 only, like 1/3 of the intraventricular septum. We're gonna see the rest is supplied by إيش? But in the coming slides. كده we're done with with the right coronary artery and its branches. Now let's move to the left coronary artery. So هنا we saw in the right coronary artery إنه the right coronary artery هي بنفسها عطتنا branches. يعني this is the right coronary artery. It gave us branches from itself. And we spoke about all of them, right? For the left, it's a bit different. The left is lazy, okay? So it's not going to give us branches from itself. It's just going to give us two main branches, and then these branches are going to give us further on more branches, okay? The left coronary artery is just lazy. It's going to originate from when? The left aortic sinus, as we mentioned above. زي الرايت من الرايت aortic sinus والleft من left aortic sinus. طيب الكورس حقها, or where does it run? Where is it exactly? Between the pulmonary trunk and the left auricle. ومهم نقول left auricle, not left atrium, okay? لأنه in the anterior view we can't see the left atrium, we can only see the auricle, okay? So the course for the left coronary artery is going to be the pulmonary trunk and the left auricle, okay? It's going to be here between them. So we said it's going to divide into two divisions. So what are these two divisions? It's going to give us the first division known as the circumflex branch, or the left circumflex branch. تمام? The second division is going to be the LAD اللي هي تشبه ايش؟ PDA. So هنا عندنا PDA في الرايت وفي اللفت عندنا LAD. What does it stand for? It stands for left anterior descending artery. Left anterior descending artery. تمام? It has another name known as anterior intraventricular artery. It reminds us of something. Here we said it's posterior intraventricular artery. صح؟ So we can see هنا هذه التشابهات اللي بين الرايت واللفت. تمام؟ So هنا قلنا عندنا posterior interventricular إنها من ورا, وهنا عندنا anterior interventricular. Where is it? هنا عندنا anterior interventricular لأنها it's between the two ventricles بس anteriorly. Okay? And we need to know the second name, which is LAD, left anterior descending artery. تمام? Now let's see the branches that branch from what? They branch from these two branches, not from the left directly. يعني هناك في الرايت they directly branch من الرايت. أما هنا في left they don't directly branch from the left coronary artery. They branch from the branches حقة left coronary artery. طيب? So البرانش الأولى we said هي إيش? Circumflex coronary branch or artery. Okay? So this is the first branch of the left coronary artery. So it gives us 5 branches. What are they? They're very simple and they're easy and they're similar to the branches of the right coronary artery. Let's see them. The first thing we said إنه أصلا the circumflex, okay, is the one here, right? It's between the left auricle and the left atrium, right? and برضو pulmonary trunk يعني it's between all of them كده. You can see them, it's surrounded by these three structures, right? So it definitely needs to give branches to them. So first branch is gonna be to the left atrium, okay? لأنه left auricle وراها طوالي left atrium, right? So here it's gonna give a branch to the left atrium, تمام? So the first branch that's gonna come from the circumflex coronary branch is gonna be to the left atrium. So the first branch is gonna be a branch to the left atrium. The second branch is gonna be to the left ventricle. But you remember we said the ventricle is bigger than the atrium, so it needs more than one branch. We need to give it two branches. So هنعطيها one branch which is the branch to the left ventricle, and then we're gonna give it another branch from the side or from the margin. So we're gonna name it as left marginal branch. Left marginal branch of the left ventricle. يعني هنا كان عندنا right marginal branch وهنا عندنا left marginal branch. كده we're done with with the left atrium, البرانش حقت left atrium والبرانش حقت left ventricle والبرانش حقت margin or the marginal left branch. تمام؟ We have two more branches which are the SA node and the AV node. So عندنا artery to the SA node and artery to the AV node. ولكن مو قلنا هنا 65% of the people get the artery of the SA node from the right coronary artery. What about the rest? We said the 35 rest of the people, where do they get it from? They get it from here, the circumflex. So 35% of the people get the artery of the SA node from the circumflex, which is mainly from from the left coronary artery. تمام؟ وال 20% لأنه هنا we said 80% of the people get the artery of the AV node from from the right coronary artery. صح؟ يعني it's a branch of the right coronary artery. This is an 80%. ال 20% الباقيين من وين؟ يكون من a circumflex coronary branch, which is from the left coronary artery. تمام؟ So كده we're done with the branches حقت ال circumflex, or the branches that come from the circumflex coronary branch, which is mainly from from the left coronary artery. Let's move to the second branch, which is which is LAD, also known as anterior interventricular artery. طيب ال anterior interventricular artery هنا قلنا in the posterior one, if you remember, we said, where is it? Here. We said the posterior اللي هي PDA, posterior descending or posterior interventricular. قلنا there's a twin معاها, which is another vein known as the middle cardiac vein. So we said this artery always has a vein with it, which is known as the middle cardiac vein, right? So طبعا for the anterior one we have the same thing. For the anterior one we have an anterior interventricular artery, also known as left anterior descending artery, has a pair or has a twin خلاص, which is a vein, which is known as the great cardiac vein. تمام? So the anterior interventricular artery or the LAD بيمشي معاها الجريت كاردياك فين. So LAD معاها great cardiac vein, و PDA معاها معاها الميدل cardiac vein. So PDA معاها middle cardiac vein, LDA معاها الجريت cardiac vein. تمام؟ What does it supply? Similar to the stuff that the PDA supplies, اللي هو sternocostal surface of both ventricles. So sternocostal surface حقت both ventricles, وهنا كان diaphragmatic surface of both ventricles. طيب so هنا كان diaphragmatic surface of both ventricles, وفي ال anterior it's the sternocostal surface of both ventricles. تمام؟ وبعدين ال interventricular septum برضو زي اللي فوق قلنا هنا for the posterior it's 1/3 of the interventricular septum. أما هنا it's the remaining, which is 2/3 of the interventricular septum. يعني ممكن نتخيل السبتم كأنه كذا like rectangle or square. طيب so this part اللي هو 1/3 is supplied by it's supplied by the posterior part. أما ال 2/3 it's supplied by by the anterior part اللي هو ال anterior interventricular artery. تمام؟ وبعدين آخر شيء هنا which is different يعني من اللي فوق ال AV bundle. طيب اللي هي the conducting system. So these are the things that the anterior interventricular artery or the LAD supplies. تمام؟ طيب now let's see coronary dominance. What does coronary dominance mean? It's where the coronary artery is dominant. تمام؟ Or where it's found the most. تمام؟ So in general in 70% of the people يعني 70% من البشر بيكون co-dominance of the coronary artery. What does co-dominance mean? يعني they're equal. يعني right والleft زي بعض. هنا we can see left الأحمر والright الأخضر. Okay, so the left is the red one and the right is the green one. So the co-dominance is found in 70% of the people. So 70% of the people have the posterior interventricular branch and the circumflex branch, which is also known as the anterior interventricular branch. They have them equally. تمام? So you can see they're equal. But 15% of the people have right dominance and the other 15 have left dominance. So here we can see in the right dominance, from its name, right dominance means the right side is more dominant than the left. Okay, so here you can see the right side is more dominant, especially in the posterior part, we can see it. وهنا في left we can see إنه the left side is more dominant. So what's dominant? The posterior interventricular artery is a larger branch. This is in the right dominance. So in the right dominance, the posterior interventricular branch, also known as PDA, خلاص اللي هي posterior descending artery, it's more dominant, or it's like كده أكبر من left side. تمام؟ أما on the right, or in the right dominance, what the case is different. It's the posterior interventricular artery, برضو PDA, is a larger branch of the circumflex coronary. What does that mean? إنه هنا we can see إنه the circumflex is supposed to give us it's supposed to give us an anterior, right? But here in the people that have left dominance, the posterior interventricular is a branch of the circumflex. So that's why we can see it more dominant in the posterior side. تمام? Now let's move to the veins. كده we're done with the arteries and the dominance and all that. Let's move to the veins. For the veins, we have 3 veins. This is the most important one, which is the coronary sinus. So let's talk about these two. لأنه they're small, we want to finish them quickly and then come to the big boss اللي هو coronary sinus. So أول شيء we have vena coides minimi. Vena coides minimi ما عندهم شخصية. They're basically كده small branches of veins that just go in all the chambers. They don't have a specific place. They go to all the chambers and they act like channels between the artery and the chamber. That's all we need to know about them. هم كده small veins يكونوا everywhere in all the chambers. But then we have an anterior cardiac veins. An anterior cardiac veins, where do they come from? They arise from the right ventricle. يعني بيطلعوا من the right ventricle هنا. Okay? وبعدين وين بيروحوا? They go to, or they terminate in, the anterior wall of the right atrium. طيب فبيطلعوا من ال left ventricle and they بيطلعوا من ال right ventricle وبيروحوا لل anterior surface of the right atrium. It's all on the right side. They go from the right ventricle to the right atrium. Okay? Right ventricle to right atrium. There's sometimes 2 or 3 veins. Okay? And they go كده in parallel arrangement. تمام? So كده we're done with these 2 veins. Let's move to the main one, which is the coronary sinus. So we can only see it in the posterior view. Okay? And it's between the left atrium and the left ventricle. Okay? Or we can say it's between the left atrium and the diaphragmatic surface. Same thing. خلاص? So it's between the left atrium and the left ventricle. تمام? Where does it terminate? It terminates in the posterior wall of the right atrium. Let's see what are the branches that قلنا arteries في branches بتطلع منهم. So the arteries give us branches. For the veins, it's the opposite. They receive. Okay, so we have branches that drain in the coronary sinus. Let's see which branches drain or come in to the coronary sinus. Okay, we have 5 branches. What are they? Or 5 veins that drain in the coronary sinus. What are these 5 veins? These 5 veins are, here we have a triplet. They're together. Great cardiac vein, middle cardiac vein, and small cardiac vein. So these 3 are together. And if you focus from the beginning of the lecture, you're going to realize that we mentioned the great cardiac vein and the middle cardiac vein before. Where did we mention them? We mentioned them when we were talking here about the arteries. So صح قلنا إنه in this artery اللي هي ال PDA, posterior descending artery, قلنا there's a pair معاها, which was known as the middle cardiac vein, right? And also same thing for the great cardiac vein. When we were mentioning the LDA, which is the left anterior descending artery, we said there's a pair with it, which is known as the great cardiac vein. Okay, so here now we're going to talk about them in details. So el great cardiac vein, remember it comes from the left side. Great cardiac vein comes from the left side. You can remember it in a way that the left side is the side that has the left ventricle, right? Where left ventricle بيpump للأورطة وأغلب الجسم. So it has more blood supply than the right. Okay, this is not anatomically correct, I think. I'm not sure about it, but I just said it so you can remember it. Okay, so قلنا left فيها it pumps blood to the whole body, right? So that's why it needs more blood supply. فremember إنه the one on the left خلاص اللي هي بتحتاج a lot of blood supply is the great cardiac vein. Okay, so the great cardiac vein is on the left. أما on the right لأنه الرايت صغيرة ما يحتاج فنحط لها إيش small cardiac vein. Okay, so on the right we have the small cardiac vein, on the left we have the great cardiac vein, in the middle we have the middle cardiac vein. تمام. Where is it specifically? It's in the posterior interventricular groove. In the posterior interventricular groove. So the middle cardiac vein is in the posterior interventricular groove مع مين؟ مع ال PDA اللي هي posterior descending artery. طيب. So كده we're done with the first three veins. Now the second two. The other two are the posterior vein of the left ventricle and the oblique vein of the left atrium. So the coronary sinus حالها حال كل structures we mentioned above. Whenever we have a structure, we have to see where it passes through, right? So we said the coronary sinus is between and it's between the left atrium and the left ventricle. So it's definitely gonna drain or it's gonna receive veins that come from these two sites or these two structures. So the posterior vein of the left ventricle, so it's this one number 4, posterior vein of the left ventricle and the oblique vein of the left atrium. تمام. كده we're done with the 5 veins that drain into the coronary sinus or that go into the coronary sinus. Okay, here this is a summary of all the grooves and the artery and vein that are found in each groove. Okay, and this is probably going to be a site of question, so focus on it. Even the doctor said this is a site of question for the OSPE as well. So let's go over them. First of all قلنا anterior interventricular groove اللي هي هنا anterior interventricular groove. إيش ال 2 arteries and veins that go into it? We have LAD اللي هي left anterior descending artery, also known as anterior interventricular artery, and it has 2 names which is here. وقلنا دائما مع ال LAD معاها إيش؟ معاها ال great cardiac vein. So LAD معاها great cardiac vein. Okay, then we have the posterior interventricular groove. So قلنا ال posterior interventricular groove بيجي معاها مين؟ اللي هي ال artery is definitely ال posterior interventricular artery or ال posterior descending artery PDA. So PDA معاها مين؟ معاها ال middle cardiac vein. PDA معاها ال middle cardiac vein. بعدين آخر شيء we have ال coronary groove. ال coronary groove عندنا right and left. يعني عندنا right and left artery و right and left vein. بعدين عندنا sinus. الساينس إيش؟ الساينس من اسمه coronary sinus لأنه هي coronary groove حيكون في ال coronary sinus. تمام؟ أما ال arteries وال veins. ال artery on the right we're gonna have إيش؟ ال coronary artery اللي هي هنا. It's not very clear but you can see it here. هي إيش؟ ال coronary artery. تمام؟ And on the right for the vein what are we gonna have? قلنا الرايت في الفين إيش حيكون اللي هو الصغير لأنه قلنا الرايت side it doesn't pump للبودي ف it needs إيش نعطيه الصغير فحنعطيه إيش small cardiac vein. So on the right for the vein we're gonna have the small cardiac vein and for the artery we're gonna have the coronary artery. Let's move to the left now. For the left side we're gonna have for the artery the circumflex artery and the vein we're gonna have the great cardiac vein and we said the left pumps to the whole body so it needs the great cardiac vein. Okay, كده we're done with with the grooves and arteries and veins that are in each groove. Now let's move to the last part of the lecture which is the surface anatomy. Okay, the surface anatomy is very easy but it has some numbers so remember the numbers. Okay, it's gonna make it easier. So for the surface anatomy we're gonna draw a shape which supposedly looks like a square I guess or a rectangle, I don't know, but we're gonna draw it by labeling points in the chest. Okay, in the chest area which are A, B, C, D. What are these points or where are these points specifically? This is the important point. Where are these points? We're gonna remember the numbers 2, 3, 6, 5. 2, 3, 6, 5 and remember in 5 is different. Okay, keep that in mind, that's why it's in a different color. We're gonna see how it's different. So first point A is gonna be where it's gonna be in the second costal cartilage. Here we have A in the second costal cartilage. Then let's move to B. B is gonna be in the third costal cartilage. Okay, so slightly below, a little bit below كده يعني it's a slanted line. So First point A is going to be in the second costal cartilage. Second point is going to be in the third costal cartilage. But then we're going to move downward. We're going to move to point C. Point C is going to be in the sixth costal cartilage. Sixth costal cartilage. Then the last point, which is D, is going to be where? It's going to be in the fifth intercostal space. Not the cartilage, in the intercostal space. So it's going to be in the fifth intercostal space. Okay? Then we're going to connect these 2 points اللي هما D and A. Okay? Then we have a shape like a تقريبا like a square كده, semi-square shape. Okay? So we're gonna see the points that we connected هيكون في border في النص. Okay? So بين A and B, between A and B, which are edge between the second costal cartilage and the third costal cartilage, this line we're gonna draw in between is known as the upper border. No, clearly it's the one above, so it's the upper border. Okay, the second border that we drew between point B and point C, خلاص, is gonna when we connect these 2 points, it's gonna be the right border. Okay, because it's on the right side of the patient or the person. بعدين we have the left border is going to be between point A and point D. Okay, so point A and point D, we're going to have the left border. Okay, and last thing here, between point C and point D, we're going to have the lower border. Okay, so here there's a mistake. Let's fix it. This is supposed to be the right side and this is supposed to be the left side. Okay, so this is the right side. I just paid attention to this, so we switched them. Okay, so okay, this is the right border. This is the right border and this is the left border. Okay? This is basically everything that's written here. So an easy way to remember it, as I said, 2, 3, 6, 5. 2, 3, 6, 5. These are the surface anatomy of the heart. Why is this important? It's important for surgical purposes and so on. Okay? One more point that's not drawn here, or that I didn't mention it in this drawing, is the distance between the point and the sternum. Okay, so for example, point A, point B, and point C, all of them, the distance is 0.5 or 0.5 inches from the sternum. Okay, ولكن we said D is the different one, صح? We said أصلا it's in the fifth intercostal space. It's not even in the cartilage. So this one has a different one, which is 3.5 inches from the midline. So I'm not sure if the doctor will ask about the numbers, but you can just know it. It's not very difficult. 0.5 for A, B, and C, and then for D it's 3.5. Okay. And one more thing here as well is the coronary groove. For the coronary groove, how do we know, or where exactly is the coronary groove anatomically? It's if you draw a line between point C, which is the point we mentioned here in the sixth costal cartilage, all the way to the third costal cartilage. Okay, here this is the third costal cartilage. So all the way to the third costal cartilage, from point C to the third costal cartilage, this is the coronary groove. Tamam? So this area in purple is the coronary groove. Tamam? Now let's move to the surface anatomy of the valves. Okay, so for the valves, there's an easy way to remember it, which is PAMT, which is pumped. Okay, pumped, خلاص, 3344, 3344. Remember that. Okay, we're gonna see what 3344 means. Okay, so we know pumped are the first letter of each valve. تمام. So this is the pulmonary valve, the aortic valve, the mitral valve, and the tricuspid valve. Let's see them close up here. So where are they exactly? Specifically when الpulmonary اللي هو P, first one, is where قلنا 3344. It's in the third costal cartilage. Third costal cartilage. Aortic is in the third intercostal space. يعني هنا third costal cartilage, and here third intercostal space. So remember, PA اللي هما pulmonary and aortic. P is in the third costal cartilage and A is in the third intercostal space. Then we have the mitral and the tricuspid. Mitral is in the fourth costal cartilage and the tricuspid is in the fourth intercostal space. That's why we said pumped 3344. Okay? Costal cartilage space. Costal cartilage space. Okay? This is everything I just said. Then the last thing for real now, we have the angioplasty. What is the angioplasty? Angioplasty is the clinical application. So it's the process where we insert a catheter in the patient to make sure and to check if there's any like pluggage or there's any block in any of the arteries. Okay, so how do we do this procedure? We go to the femoral artery specifically and we insert the catheter. Okay, it's the one in blue here. So we insert the catheter, okay, and it goes all the way here, all the way to the ascending aorta. So this is the ascending aorta, right? And then we release the pigment, okay? When we release the pigment, it stains the arteries, right? So when it stains the arteries, we can see it here. The artery is getting stained, so we can see it very clearly. There's a gap here, there's an area that's not very clear, right? That means there's a pluggage here. So once we realize, or once the doctor realizes there's a pluggage here, or there's a gap here, خلاص, they know that there's something wrong, okay? So what do? They do like further procedures and everything, and they can use a stent اللي تنحط في vessel, so it can open or expand or widen the passage of the artery so the blood can flow smoothly and easily, okay? So this is all we need to know for the angioplasty. You can read more about it if you wish. So here we have the case scenario. It's very easy. It's in the beginning of the lecture. You can answer it if you understood the lecture properly. And good luck.